dear viewers, welcome back to my channel. Have you ever wondered why deodorants and antiperspirants are so popular? For today's vlog, we will be talking about hyperhidrosis. It is defined as an abnormal, excessive sweating that's not related to heat or exercise. Sweat is produced by the eccrine glands or the sweat glands, which are abundant on the feet, the face, the palms, armpits, and when the nerves that activate the sweat glands overreact, then hyperhidrosis results. Normally, sweating happens to first regulate the body temperature, example of which is during physical activity or in hot weather. Second is when one gets nervous or during emotional stress because of adrenaline release. This can become a source of anxiety and embarrassment. In fact, the youngest patient that I have encountered in my practice is a 16-year-old patient brought to me for treatment by her parents because of this particular problem. She was already developing inferiority complex because of this. Areas usually affected are the face, the axilla, the hands, and the feet. Take note that sweating is the body's mechanism to cool itself. There are actually two classifications of sweating. First is the primary focal type of hyperhidrosis, which happens when the nerves responsible for signaling your sweat glands become overactive without any trigger. Manifestations of hyperhidrosis are clammy or wet palms and soles of the feet, heavy and abnormal sweating that soaks clothing. Since no medical cause has been found, it is in all probability hereditary, or it could be caused by some medicines and the intake of certain food supplements and spicy foods. The next one is secondary hyperhidrosis, which is the less common type caused by certain medical problems like menopause, which causes hot flashes, low blood sugar, diabetes as a result of nerve damage, and nervous system disorders, to name a few. The downside is that being more sweaty, patients are more prone to infection. Urine and blood laboratory tests are recommended to diagnose if it is caused by certain medical conditions like hyperthyroidism or low blood sugar, fever during an infection, and obesity, to mention a few. The most common case that I encountered in my practice is hyperhidrosis of the axilla. For this, I do an eyelid starch test to pinpoint the areas of sweating. To address this, my favorite treatment is to administer botulinum toxin injections to temporarily block the nerves that cause sweating. This gives relief for at least 4 to 6 months. Other possible treatments are, of course, prescription antiperspirant with aluminum chloride, nerve-blocking medications, and anti-anxiety medicines. Surgically, I also do sweat gland removal, which is actually a minimally invasive liposuction procedure with curettage. For the armpits, sympathectomy, nerve surgery for hand sweating can also be done, but it is not exactly my treatment of choice, as this may trigger excessive sweating in other areas of the body. I hope you find what I just shared very informative. Should you have any questions, please do leave your comments on my comment section below. And also please do subscribe, like, share, and click the bell button to get notified. God bless you. Stay safe, healthy, and of course beautiful. And by the way, greetings to Maya Villarman.